Well, welcome to the Smart Choice Health Insurance Decision Making webinar. I'm glad that you have taken some time to view this video and hope that you walk away with some valuable information to help you make better or smart choices about your health insurance. This presentation is sponsored by SDSU Extension. I am Lorna Wounded Head. I'm the Family Resource Management Field Specialist for SDSU Extension, and my office is located in the Sioux Falls Regional Center. I work with consumers across the state of South Dakota, providing education and resources to help individuals manage their personal finances. During today's session, I will discuss important health insurance terms, cover the importance of health insurance, and look at things that you can do to choose health insurance plan that best meets your goal. So just want to say thank you very much for taking time to view this webinar today. Just going to close this up here. There we go. All right. So today's goals are to understand why health insurance helps prevent large unexpected healthcare expenses, learn what to compare to understand the cost and coverage, and to identify information needed to make smart choices. The reason these goals are so important is that consumers say they're very confused about making health insurance purchasing decisions. And they say that they're not confident about making a good choice. So today, I just want to explore that basic information with you to help you become more confident in making your health insurance decisions. Understanding this information will help you become more confident when you're making those plan choices. So to get started, I'd like to share an experience that was recently shared with me. I would like you to meet Jamie. Like many of us, Jamie is busy with the duties of daily life, managing work and home. Jamie is single, relatively healthy, and has been trying to make ends meet, so health insurance just has not been a priority. Unfortunately, Jamie slipped, fell, and had to go to the emergency room. As you can see here, this fall was pretty bad and Jamie needed emergency surgery. This became a pretty stressful situation because Jamie was uninsured and had very limited savings. Jamie was preparing to move this month and had saved just enough money for the security deposit and first month's rent. Like Jamie, we each have fallen, slipped, or tripped. Often we get lucky, but sometimes a fall, a slip, or a trip can result in a broken bone, or worse, the cost of an injury can be very surprising. This accident was something that Jamie hadn't planned for. However, Jamie recognized the very real cost of not having insurance when the bill arrived. Because of this experience, Jamie decided it was time to purchase health insurance, but was confused about how to make that decision. So while you're listening to this, I want you to kind of think about how much do you think Jamie's broken arm would cost? Just kind of have that number in mind. I'm going to give you a couple seconds to think about it. And then I'm going to move on and actually show you what those costs were. All right, here we go. The cost of a broken arm. So here's how the expenses added up at the hospital. After the fall and arriving at the hospital, Jamie was admitted to the emergency room, had blood drawn, x-rays taken, and received pain medication for the surgery by the anesthesiologist. Finally, Jamie's arm was set and put into a cast by a doctor. So you can see from these numbers, he is already well over $7,000 with those costs. Then the follow-up costs, or the outpatient costs with the specialist, in order to get the hard cast and to get more x-rays, were almost $2,000. So as you can see, the total cost without insurance was over $9,000. So some things that might surprise you most about this chart, and keep in mind that this is information for someone who had no insurance. So all of the expenses were going to be paid out of pocket. But the pharmacy and drug expenses are over $2,000, hospital supplies over $2,000, and the emergency room. And these were just, he did not have an overnight stay. This was just going to the emergency room, getting his arm taken care of, and then a follow-up visit. So remember that this is one example and it's only based on a single event, that broken arm. For you or for anyone you know, rates and charges may vary based on where you live, where you get services, and the type of facility. However, you can definitely understand and see why Jamie wanted to consider health insurance. Without health insurance, he has to pay the full bill. So moving on, just to look at some cost comparisons. And keeping in mind that we're making the assumption that no other medical expenses had been incurred up to this point in the year. So this example shows you how just one health insurance plan could affect the financial burden and the health of Jamie. The plan shown here is a marketplace plan. However, a difference would also be seen with an employer-based plan. When you have health insurance, the costs of care are offset and will be less than without health insurance. Therefore, a decrease in costs will be seen regardless of plan type. Now that we know how much a broken arm costs without health insurance, shown here in the second column, let's look at the costs that Jamie would have had with one sample health insurance plan. This summary plan is an example that only includes coverage relevant to a broken arm and was taken from the full summary of benefits and coverage of health insurance plans available through the health insurance marketplace. So a few things to look at for this comparison is that the health insurance plan, or the plan from the marketplace, did have a $4,000 deductible. The deductible is how much Jamie would have to pay out of pocket before insurance starts covering the costs. But as he very easily met that deductible, he was able to have future other costs reduced. So for example, the lab and the x-ray costs were reduced. The lab and x-ray costs weren't reduced, but the ER services were reduced because he'd met the deductible. The primary physician's office visit was reduced. His specialty office visits were lower. His hospitalization was also lower. And then his outpatient costs were lower in addition to his prescription costs. So for him, the cost of the broken arm was almost cut in half. So with health insurance, he would have only had to pay $5,000 out of pocket rather than the $9,000. Now you'll see at the bottom of the chart that in the insurance column, the total cost is $6,000 or over $6,000. What that includes is the premium, that the $1,013 premium that he has to pay each year. All right. So moving on, we want to talk about why we need to have health insurance, or explore the why of health insurance. So why do we need to have health insurance, and why is it so important in being able to make a smart choice? So why do we need health insurance? You're most likely viewing this webinar because you have a health insurance, because we in the United States have a health insurance law that emphasizes the importance of having health insurance. Just viewing this webinar shows that you know the importance of having health insurance. There are many reasons why having health insurance is important, and I'll go through those here in the next couple of minutes. But having health insurance is a way to manage potential risks. In this case, the risk of becoming injured, the risk of getting sick or developing a chronic health condition such as diabetes, and the risk of needing to pay a lot of money for health care. If a health problem happens, the results can be costly. Health insurance helps reduce that risk, especially the financial one. Let's quickly review why we need health insurance. As Jamie realized, having insurance protects us against the big things that we can't plan and prepare for. So good health insurance, or good health is important, and there are many things that we can do to maintain good health. But sometimes we need medical care to help keep us from getting sick or to help us get better when we are sick or injured. Medical care can be expensive, so having health insurance can help us get and pay for the care that we need. If you have health insurance coverage, this decreases those out-of-pocket medical expenses, and for those reasons, having health insurance may provide peace of mind to you and to your family. Having health insurance helps protect your family's financial future. In 2013, over 20% of American adults were struggling to pay their medical bills. This means that out of every 100 adults, 20 adults have problems paying for care. Sometimes families go into bankruptcy because they can't pay all their bills. Again, in 2013, 3 in 5 bankruptcies were due to medical bills. Recent research also shows the medical bills can completely overwhelm a family when illness or injury strikes, and that millions of people don't take their medications because they cost too much. Not taking medicine is a way that they try to control their medical costs, but may put their health at risk. Health insurance helps pay costs when you need care and protects you from very high medical expenses. You may not think that you need health insurance right now, but you could be like Jamie and have an accident that costs a lot of money. Health insurance can help manage that risk, the chance that an accident or illness will happen to you or to your family. With insurance, you have to pay in advance through a monthly premium. You can't sign up for insurance when you get sick or hurt. With automobile insurance, it's the same thing. You pay in advance. You don't sign up when you have a car accident. The goal is to have coverage in place well before you need it. And certainly, health insurance helps prevent large, unexpected healthcare expenses. Many health insurance plans offer services and programs to help keep you healthy. If you take advantage of these services and programs, you will likely save money over time. In addition to annual wellness visits, some plans offer benefits such as personal wellness coaching, healthy pregnancy programs, gym membership discounts, nutrition counseling, online seminars or webinars, and checklist tools and calculators. Having health insurance can lead to better health outcomes. If you and your family have adequate insurance coverage based on your healthcare needs and wants, and use your health insurance as it is intended to be used for prevention visits, immunizations, etc., you will likely have better overall health. And if illness like the flu or measles is prevented, you aren't out the cost of care, and you will likely not miss work, or your children will not miss out on school. Next, we're going to look at a chart that gives some information to help you compare costs of different types of insurance plans. The way this visual is set up is that the rows show the type of coverage and the columns show the expenses for each of the plans. The blue column represents a bronze HMO, the pink a silver HMO, and the green shows the expenses for a gold PPO. Notice along the left-hand side are the listings of the type of services and coverages offered by each plan. As you look at each service or type of coverage for each option, you'll find important information such as out-of-pocket costs or limits, and you'll find what is covered and not covered by reviewing the list. So looking at this chart, I'm going to ask a few questions and give you a few minutes to kind of think about what the answer to that question would be. The first question is, what information is this chart telling us? So what specifically can you find on this chart? As I said, that this chart is showing the costs of different health insurance plans and to be able to make that comparison. And it's really important to look at what are going to be your out-of-pocket costs, such as like what it's going to cost after a deductible when you go to a primary care physician, or if you have to visit a specialist, looking at costs with hospitalization, outpatient care, and that type of thing. And then also your co-payments. In addition, it shows you your premium tax credit, which is available to individuals who meet income requirements. Not everyone receives a tax credit for their insurance premiums, but for individuals who do, this can be a nice cost savings for everybody. Then you also have to look at what the deductible is. And the deductible is the amount of money that you're going to pay before insurance starts covering costs. The higher the deductible doesn't necessarily mean the insurance is bad. That just means that you're taking on more financial risk when it comes to your health insurance and your health care expenses. And then out of pocket. Out of pocket is the amount of money that you're personally going to pay. Just in the example of Jamie, essentially he paid over $9,000 out of pocket because he didn't have any insurance coverage. And there are always out-of-pocket maximums for the different types of premiums. So this chart provides that specific information about 3 different types of plans, and showing you essentially what it's going to cost you personally to be able to have this plan. This chart is specific to the example we provided with Jamie's broken arm. And so the financial information tells us the bottom line for out-of-pocket expenses for this insurance. The premium amount both per month and for the whole year for each plan, as well as the cost for covering the event of Jamie's broken arm. So you can see that just by looking at the overall costs, you would think that the plan number 2 or the silver plan is going to be the least expensive in this situation. In terms of the cost of the broken arm, though, the gold plan was the better option or the least expensive. But what I want to do next is talk about those the health insurance terms. When it comes to determining and deciding which health insurance policy is going to be the best, you want to make sure that you understand that terminology. And many of the terms associated with insurance aren't necessarily intuitive, or the way they're used outside of insurance doesn't necessarily mean the same thing when they're using in reference to insurance. All right. So we are going to look at health insurance and being able to translate some of those terminology into some plain language. So we have, first of all, copayment, which is a fixed amount that you pay for a covered health care service. It's usually when you get the service, and you can and the amount can vary based on the type of service. So the copayment in plain language is the amount of money you pay when you get a healthcare service. Many times it is shortened and you hear the term copay. So for example, if you have a $20 copay for doctor visits, you're going to pay $20 each time that you go to the doctor. The next term is the deductible. I explained that a little bit already, but it's the amount that you owe for healthcare services that your health insurance or plan covers before the insurance begins to pay. So in plainer language, it's the amount of money you have to pay for your healthcare before your health insurance kicks in. Just as a difference, the copay is the amount of money you pay when you get a healthcare service. So in other words, your health insurance plan kicks in only after you've paid the amount of your deductible out of your own pocket. So for example, your health plan has a deductible of $1,000. That means you need to spend $1,000 of your own money on healthcare before your health insurance will start to pay for things. So one thing to keep in mind when you're deciding on a health insurance plan is what that deductible is. If you know that you will have plenty of money set aside to plan for paying that deductible, then you can probably select a plan with a higher deductible, which usually means it has a lower premium. So then you'll pay less each month for that insurance. If you know that you're not going to have the money to pay a lot of out-of-pocket expenses, then you want to plan with a little bit lower deductible. All right, coinsurance. So your share of costs of covered healthcare service. And it's always calculated as a percentage. For example, it could be 20%, but that can vary depending on the plan. And which means that that's the percentage you'll pay for that service. And you always pay your coinsurance plus the deductibles that you owe. So for example, if the health insurance or plan's amount allowed you an office visit of $100 and you have met your deductible, your coinsurance payment of 20% would be $20. If you hadn't met your deductible, then you would pay the full amount of $100. Another term is premium, and we've talked about this a little bit, but this is the amount that you pay for your health insurance or plan each month. So if your health insurance plan premium is $30 per month, you'll end up paying $360 for the year. And the premium is paid regardless of other medical costs. So even if you make no medical claims throughout the year, you need to pay that premium. And your premium is one of your out-of-pocket expenses. So out-of-pocket expenses are any care or expenses you have that aren't reimbursed by insurance. And so these can be most of the terms that I just covered: deductibles, coinsurance, and copays. All right, let's go back to our cost of a broken arm. All right, so just as a reminder, this plan shows the 3 different types of health insurance plans, and the cost of the cost without insurance, using Jamie's situation as an example. And so we're going to look at how the charges compare across plans. So thinking about the terms that I just talked about, look, the premium, co-payments, coinsurance, and deductible amounts. We want to look at the chart for specific examples. When comparing the plans, many people are concerned most about premiums. They may not realize that the premium is not the total cost, and they may not realize there are other costs that they will have to pay. These expenses, as I already mentioned, are out-of-pocket costs, and understanding the costs can be complex as each plan covers those out-of-pocket expenses differently. For example, one plan may charge $45 copay for doctors and another charges a 10% coinsurance. You can see this difference across the plans, and this means that the total out-of-pocket costs will add up differently. Understanding that premiums and out-of-pocket costs are different for each health insurance, Jamie decided to compare plans based on how much of the cost 3 plans would pay for the broken arm. Jamie then added in the total yearly premium expenses to see what the total cost would be for each plan. So looking at the plans, the premium for the bronze plan is a little over $1,000. The silver is higher at almost $2,000. And then the gold plan is the highest in terms of premiums at almost $3,000. But as I mentioned previously, usually a higher premium means a lower deductible. And as you can see that lowest premium of the bronze plan, but it does have the highest deductible. And with those higher deductibles, then you also have a higher out-of-pocket maximum. So what factors contribute to the differences in total costs between plans? The type of plan, whether it's the bronze, the silver, or the gold, the premiums, the deductibles, and the copay or the co-insurance. But one of the big differences is due to the type of plan. The bronze plan is designed to have more costs covered by the insured, so more out-of-pocket costs. The silver plan is lower in cost because it would qualify for a tax credit. And the gold plan has a higher premium, but the deductible is much lower. And this may be a consideration if you don't have a lot of money in an emergency fund. To be eligible for the premium tax credit, your household income must be at least 100, but no more than 400% of the federal poverty line for your family size. When you are signing up for a plan on the healthcare marketplace, you'll be able to know as you're signing up whether or not you would qualify for that premium tax credit. So what plan do you think you should pick for Jamie? Many people would choose the silver plan because it has a lower overall cost and there is a tax credit to help offset premium amounts. However, there is a larger deductible. This is a consideration if you don't have much set aside for an emergency fund. And our last question, what is the value of having insurance? The major value in having insurance is that it helps you cover large unexpected healthcare costs. It also provides you access to healthcare when you need it and for preventative services. It helps you stay healthy and allows you to keep working or going to school. So we've covered quite a few of the important concepts when thinking about health insurance plan. The essential messages that we want to convey are, first of all, in order to have coverage for an accident like this, insurance coverage has to already be in place or in effect. And there is a trade-off when comparing costs and coverages, and health insurance does have a value. Hopefully you now understand that out-of-pocket costs and premiums can vary across the types of health insurance plan. Using Jamie's situation helps us see that insurance could have helped Jamie with the injury costs and could help us out. So now we're going to look at the what. So what information do I need to get or find out? And what do I need to compare or consider in order to make a smart choice? Many questions are raised when people are making decisions about health insurance. And a lot of those are, what do I even need to think about when I'm making a decision about which plan is going to be the best for me? So it is important to know where to get information in order to help you make that decision. It's also important to consider what you need to know, find out, compare, and consider. Often people compare health insurance plans based on the cost of the premiums alone. But it's important to consider costs and coverage that best meets your health and financial needs and wants. Some information you need is available in the health plan summary of benefits, and sometimes you may need to call the insurance company. And sometimes you'll just want to talk with a person trained to help you enroll in the health plans available to you. Knowing what you need and where to get the information can help you make a smart choice health insurance decision. In this section, I will show you a set of worksheets that you can use to help make insurance decisions. After the session, you can contact me and I will email you the worksheets so that you can have a copy of them for yourself. So the first worksheet is to determine your health insurance needs. As you get organized and before you start, digging into the questions or the information you need to consider, you want to get an accurate picture of your current health and medical spending. So some documents that you might want to gather in advance of completing some of this work is a monthly explanation of benefits from health insurance companies of expenses that you have had, prescription records or statements from the pharmacies that you use, credit card or bank statements or your check register so that you can see what your out-of-pocket expenses are, and a calendar to review the frequency of medical appointments or call your doctor's office to obtain that information. In the My Health Insurance Needs worksheet helps to inventory the health insurance services consumers and their families use or will use in the future. Because many health concerns are seasonal or ongoing, reviewing last year's health records from the doctor, pharmacy, or current health insurance provider to estimate what future health service use is and the frequency with which they are used. Consumers also need to consider anticipated healthcare changes, and there is a place to list those on this worksheet. So this worksheet does have 5 sections, and on the screen, section 1 is visible. I'll just give you an overview of what the other sections involve, and then when you request this worksheet, you'll be able to see all of the sections. So section 1 is all about your family doctors. What this is asking is, who did you see and how often did you see them? To fill out this information, you can either look through your personal records, get a printout from your doctors on how often you visited, or call the insurance company and get a copy of your explanation of benefits. Once you have the information, simply fill in the chart based on your use. For instance, if your primary care or family doctor is Dr. Smith and you saw him 3 times, you would fill in Dr. Smith under the primary care column and write 3 times. Repeat this for each type of doctor for you and your family. Section 2, which is on the next page of this worksheet, is all about your prescription drugs. Don't include your over-the-counter drugs, as the insurance company does not pay for those. You will include your over-the-counter drugs in the spending plan. To get this information, you can look at your medical records, call the insurance company for an explanation of benefits, or go to the pharmacy and get a printout of what you had filled and how much it was. Then fill in the chart with the appropriate information. Section 3 asks you to reflect on any upcoming changes to you or your family's health situation and to fill it in. For instance, is your child getting ready to turn 26 and you don't have to cover them anymore? Are you getting ready to have another child? Do you need to have medical procedure done, like LASIK or elective surgery that might have high out-of-pocket costs? These are things you want to consider when examining health plans. And then section 4 is designed to help you and your family figure out what is most important in a healthcare plan. We asked a lot of what is the best plan, and the answer is there isn't one. The best plan is the one that fits your family situation. What we are asking you to do is to reflect which of these is most important and which is least. Then number them by their importance level. Whatever is most important, put 1 on that line. And for the second most important, put 2 on the line, and do this for all of the options. Finally, in section 5, you summarize the types of care that you need. Look at how you use insurance and upcoming changes, and simply check all those services you will want to pay particular attention when comparing your health plans. The next worksheet then is a comparison of those plans. And this helps you to compare health insurance plans and helps you organize information about health plans so that you can better comparison shop. So most consumers make their choice of insurance plans based on premium costs only. There are many other factors that are important, including the types of services covered, the maximum out-of-pocket limit, and whether your doctors are in the network. The My Health Insurance Plan Comparison Worksheet helps you to compare up to 3 plans while thinking about your needs and other factors that could affect your choice of plans. On the left-hand side of the worksheet are the important factors to consider. The 3 columns in the middle can be used to organize information about plans that are being considered. The Affordable Care Act has required plans to provide standardized information in language you can understand. In order to fill in the workbook pages, you'll want to refer to the summary of benefits and coverage documents offered by the plans you are considering. Depending on where you purchase your insurance, either your employer or the health insurance marketplace will provide this information. Consumers may need to contact the insurance company or their doctor to determine the answers to some of those questions. Section 1 provides a place to organize basic information about the plan. It asks if there are out-of-pocket limits, if your doctors are in the network, and other important questions. Section 2 provides a space to organize coverage information, such as covered services, out-of-pocket maximums, and whether you will have coverage when you travel out of network. Section 3 covers grandfathered health plans, and sections 4 and 5 are a guide to calculate out-of-pocket costs for various health services based on last year's visits to the doctor and other health service organizations. focusing on the premium and copay costs. As you can continue through this worksheet, review the costs for prescriptions, vision, and dental. And then the last section provides a summary of the costs from each of the previous pages in order to determine the total amount of out-of-pocket costs. You'll also be able to calculate the total monthly costs. This will be useful as you determine what your monthly spending plan will be when you start including healthcare costs. And this is an example of another worksheet that I will email you upon request. All right, and our next worksheet is your monthly spending plan. Just like with the rest of your expenses, it's important to create a spending plan so you have an idea of how much money your medical expenses are going to be. There is a space on this worksheet for your health insurance tax credit if you are eligible, because that will help reduce your monthly premium costs. This worksheet helps just to organize income and expenses. And when you fill out this worksheet accurately, you can determine how much you can afford to spend on all of your expense categories, including healthcare. Our research shows that trying to estimate total out-of-pocket costs can help choose a plan that best fits into the budget. We know that the largest expenses in the family's budget are housing, food, and transportation. So you can work through the spending plan. Remember the recommended guidelines: 70% of your monthly income for living expenses, 20% for paying off debt, and 10% for saving. After your detailed review of the available health insurance plans, you can now begin to total healthcare out-of-pocket costs. All right, so key questions that I need to answer. Next one is why. Like Jamie, when faced with this insurance dilemma, the key questions are simple: why and what. So the first why is, why do I need health insurance, and why is health insurance important? And then what? What information do I need to get or find out? And what do I need to compare or consider? Answering these questions can help you become more confident and increase your understanding of basic information needed to make a smart choice health insurance decision. Additionally, you can seek out different information from other types of resources. So on the screen, we have the healthcare.gov website. The IRS has a nice website with information related to your premium tax credit and other medical expenses. You can use the health insurance marketplace calculator to calculate the cost of premiums and some other expenses. SDSU extension website has multiple articles of just simple things that you can look for when thinking about insurance, what those costs are, and even some of the terminology related to insurance. And then there's the SHINE network, the Senior Health Information and Insurance Education. This website has great resources and articles to help you answer many health insurance related questions. I want to thank you for taking time to view this webinar today. If you would like to contact me, or if you have any questions, I'm available either by phone, and my number is on the screen, or you can email me at lorna.woundedhead@sdstate.edu. And please email me if you would like to get copies of the worksheets that I went through today during this webinar. Our extension website URL is also posted, and you can also follow me on social media on Facebook at the Financially Independent Life, or on Twitter at SDSU Extension Finance. Thank you very much for your time today, and feel free to contact me if you have any questions. And I hope that you have learned something new and feel more confident about making smart health insurance choices.